So briefly, could you walk us through also what are some of the other challenges that parents might face during this journey of finding a match and getting their child treated?
So I want to address first and foremost the financial burden of taking care of a child with thalassemia. The emotional burden is also there because they are continuously trying to make life better for the child who is not able to completely attend schools because he has to undergo transfusions every now and then, he has to visit the doctors every now and then. There is a problem with compliance of medication because as the child grows up, he decides or he feels that he is entitled to an explanation as to why he is taking put on so many medications and what is it that is causing his uh, growth to be stunted. Then again, there is a social pressure, social stigma that is associated with certain diseases which are genetic. Uh, so that the family, as parents and as families, they have to face that as well. And I don't think they should require to face this. In fact, I would say that the society should come forward and adopt such families as their own and try to help them in whichever way they can, either logistically, emotionally, financially, even standing by them through the process of undergoing therapy, primary therapy, then undergoing a stem cell donor searches in the community, and even through bone marrow transplants. These families, which I would say are special families, should receive all support that they deserve in the society. Once the patient has undergone a donor search, the quest for fundraising for such an expensive therapy starts, and unfortunately, there is no social security net. None of the transplant programs in Maharashtra are covered under any yojana. So, unfortunately, the funding has to come either from the patient's own pocket or from other sources which fund these transplants. Some charitable organizations are there which fund the transplant. Now all this requires a lot of time and effort, and a lot of mental and physical agony goes into this. So my appeal to the government of India, government of Maharashtra, is that we should make sure that through the rare disease program, at least the transplants for thalassemia should be completely funded by the government program, uh, which will help us to reach our target of maximum transplants in already resource constrained countries like ours.